Tristan, we can open up the waiting room for folks to start logging in. Just a friendly reminder to everybody on the call, we will now be starting the webinar.
Okay, beautiful. Give me a second.
Hello, everyone, and welcome to the Canadian Race Relations Foundation's annual public meeting. Bonjour à toutes et à tous. Bienvenue à l'Assemblée publique annuelle de la Fondation canadienne de relations raciales. Before we begin, I would like to let you know that simultaneous French and English interpretation can be accessed by clicking the globe icon and interpretation on the bottom right of your screen. I would like to turn it over to Bob Watts, a senior fellow with the First Peoples Group, for the first words of the event. Bob, thank you for joining us today. Over to you.
Thank you very much, Chimigwech. Bonjour, Sego, Ani, everybody. Good afternoon. Just so delighted to be here with all of you. Want to recognize this territory that I'm in. I'm in Halifax right now, Mi'kmaq territory, the land of the Mi'kmaq people, and thank them for allowing me into their territory. They're hosting the Inspire Awards, so there's lots of Indigenous people in town here right now. So I've been asked to say a few words by way of opening, and the way that I was taught is that we always start with gratitude. So I just want to say, Bonjour, Sego, Kanoshin Wake Megazi Indigenous Cause, Makwadodam. So my name is Kanoshin Wak or Tall Pine. I just say Sorgoyan Diso, Creator, Jamnado, Chimigwech, and Yawagoa for this day, another start, a new beginning. I want to recognize all the beauty that we're all surrounded by, this beautiful earth, and for all the gifts that Mother Earth gives to us without hesitation, that she provides for all of us, all those worlds that consist of Mother Earth, the mineral world, the plant world, the animal world, all give to us without hesitation and out of love for all of us. And just pray and ask that that we can act in a reciprocal way and pay her back for all the good that she does for us and how she takes care of us. I also ask that Creator, you send a special blessing to those that are really struggling, whether it's with health or with other issues that they need help with, that they may receive the help that they need. I ask that you watch over all the people on this meeting and their families and their communities, that the work that's being done might help build a better community, better families, better societies. And when I say better, I mean more united and more loving and more caring for each other. So ask that we receive that help and that wisdom so we can act in that fashion. I also want to let you know I have a beautiful smudge going here. This is some sage. So I send this virtually out to all of you and ask that this medicine that it would help you in terms of a good clear mind, good clear eyes, and that when you speak with that nice mix of kindness and honesty, and that you bring your heart to bear on all this work that's being done. So it's just a great honor to be here with all of you. I just want to say on Friday night, I was at a meeting, a celebration actually in Toronto, for all the people that were involved with the negotiation of the Indian Residential School Settlement Agreement, which was historic. and really set up the work of the Truth and Reconciliation Commission and put into motion many of the things that we're experiencing and seeing with Indigenous healing, Indigenous hope now. So that was 20 years ago. And as Phil Fontaine, who was national chief back then, said, no one could have imagined, if you go back 21 or 22 or 25 years, all the things that are happening and all the changes that are happening in this country. And I think it's the same with the work that all of you are doing. I don't think anyone could have imagined in 1996 or 1997 all the incredible work that the Race Relations Foundation has done and continues to do. So it's a great honor to be part of opening this meeting. Just want to wish all of you the very, very best. Have a really good meeting and look forward to sharing a few thoughts at the end of the meeting. Miigwech, Nyawagoa. Thank you. Merci.
Thank you, Bob, for your opening remarks and for grounding us in reflection, wishing you, your family, and your community peace, health, and joy. My name is Uswa Essen, and I'm the Director of Programs and Outreach. I am pleased to welcome you all to the Canadian Race Relations Foundation's 2026 Annual Public Meeting. I am joining you today from the unceded and unsurrendered territory of the Algonquin and Anishinaabe peoples. This annual meeting is an opportunity to reflect on the Foundation's work over the past year, to share key milestones and impacts, and to engage in meaningful dialogue on the issues that continue to shape racial equity in Canada. Nous sommes honorés de bénéficier du soutien de leaders de partout au Canada qui s'engagent à faire progresser l'équité et l'inclusion. J'ai maintenant le plaisir de vous présenter un message spécial de l'honorable Marjorie Michel, ministre de la Santé, qui a gracieusement accepté de prononcer le discours d'ouverture de notre Assemblée publique annuelle d'aujourd'hui. Je vous invite à regarder ce message vidéo avec moi.
Hello, everyone. Thank you to the Canadian Race Relations Foundation for giving me the opportunity to share a few words with you today. Our collective efforts are essential to creating a society where every person has the opportunity to thrive and where public health initiatives leave no one behind. Les communautés noires, autochtones et les membres d'autres communautés racisées sont confrontés aux mêmes problèmes de santé que le reste de la population. Mais elles sont touchées de manière disproportionnée par la discrimination systémique, les préjugés et les inégalités économiques. Et même si notre société a fait beaucoup de progrès, le racisme et la discrimination restent un facteur clé qui influence les résultats en matière de santé. Au fil du temps, ces expériences peuvent entraîner un stress chronique et des traumatismes qui ont des répercussions sur la santé physique et mentale. Elles peuvent également conduire à une détérioration de l'état de santé et à une méfiance à l'égard du système de santé. Les répercussions ne sont pas seulement individuelles. Elles se répercutent sur les familles et les communautés et s'étendent sur plusieurs générations. Advancing racial equity in our healthcare system is not a choice. It is a must. It is essential to building a stronger, fairer system for everyone. And across the country, we are taking action. Grâce à vos plaidoyers et votre engagement, de nombreuses initiatives ont vu le jour. Que ce soit les 2 stratégies nationales antiracisme, le milliard de dollars investis dans les initiatives dirigées par et pour les communautés noires. De plus, le gouvernement du Canada investit 167,6 millions de dollars sur 5 ans pour lutter contre le racisme anti-autochtone dans les systèmes de santé du Canada. These projects will improve healthcare services through the hiring and retention of Indigenous patient advocates, health systems, navigators, midwives, and birth support workers. No one in Canada should have to wonder whether they will be treated with respect when they seek care. They should know they will be heard and supported when they need it most. That is the future we must keep building together in partnership with provinces and territories, indigenous partners, racialized communities, health workers, researchers, and community leaders. During this time of global turmoil, we are coming together to build Canada strong, a more independent, secure, and prosperous country that works for all. I want to thank the Canadian Race Relations Foundation for your leadership and partnership and for the important role you play in advancing racial equity across Canada. Je vous souhaite des discussions fructueuses pendant cette assemblée. Merci. Thank you.
Merci à l'honorable Marjorie Michel, ministre de la Santé, pour ces remarques pertinentes et pour votre leadership continu dans la promotion de l'équité en matière de santé partout au Canada. Nous apprécions sincèrement votre soutien à la Fondation canadienne de relations raciales et le travail important qui est accompli pour lutter contre le racisme systémique au sein de nos institutions. It is now my pleasure to introduce CRRF's chairperson, Teresa Wupa, to provide a few remarks. Over to you, Teresa.
Thank you. My name is Teresa Wupa, and I'm the chairperson of the board of directors at the foundation. I'm pleased to participate in our 2026 annual public meeting today, joining you from the traditional territory of the Neutral, Anishinaabe, and Haudenosaunee people. It is my great privilege to recognize all of the board of directors who served during fiscal year 2024-25, as well as new board members who have since joined. Anne-Marie Pham from Alberta, Dakota Kochi from Quebec, Danny Asef from Ontario, Hassan Ahmad from Ontario, Jane Rabinowitz from Quebec, Les Kojima, Manitoba, Manju Varma from New Brunswick, Nancy Rosenfeld from Quebec, Orlando Bowen from Ontario, Rihanna Patel from Ontario, Roy Pokokowski from Saskatchewan, and Sophia Ali from Manitoba. A big thank you also to Art Mickey, who has played such an important role supporting the CRRF board, going back to when the very first directors were appointed. All of us in this meeting and at the CRRF are dedicated to strengthening our collective ties and caring for one another. This is ongoing work that requires resilience. 2024 to 2025 was particularly eventful. Communities across Canada have continued to confront systemic racism, while also building new pathways toward equity and belonging. In this context, the CRRF has remained steadfast, supporting grassroots anti-racism initiatives, advancing national dialogue and policy, and working collaboratively to combat hate while safeguarding rights and freedoms. We have also solidified our commitment to listening, learning, and walking alongside communities, recognizing that reconciliation, inclusion, and equity requires sustained effort, humility, and partnership. Our 2023-24 strategic plan identified a critical priority to stabilize the organization's operations. So in 2024-25, we secured $12 million in ongoing funding through an appropriations budget that received royal assent in December 2024, marking one of the most significant milestones in our history and enabling our transition to a sustainably funded Crown Corporation. On behalf of the board of directors, I extend my sincere appreciation to our dedicated staff, whose leadership and commitment continue to move our mission forward with integrity and care. Thank you also to my fellow board members for their very thoughtful stewardship, governance, and shared dedication to strengthening the foundation. And finally, I want to thank the Government of Canada, as well as our many partners, donors, and supporters whose collaboration make this important work possible together, building stronger Canada. So this year has been both significant and inspiring. And now it's my pleasure to invite the CEO, Mohammed Hashim, to share more about the impact of our work over the past year. Before that, let us take a moment to reflect on what we have achieved together by watching our 2024-2025 Year in Review video.
Hello, everybody. So thank you very much for that video. Thank you for joining us. Bonjour à toutes et à toutes. Merci d'être avec. Bonjour à toutes et à toutes. Merci d'être avec nous aujourd'hui. That video you just saw is a snapshot of our work over the past year and a reminder of why this work matters now more than ever. But before we begin, I'd like to recognize the land that I'm on. Our head office sits on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Huron-Wendat people. Today, it remains home to many First Nations, Métis, and Inuit peoples. We also acknowledge that Toronto is covered by Treaty 13, and our staff and board live and work across the traditional territories of Indigenous peoples from all over this country. Let me start plainly. The last few years have been heavy for many of us. In 2024-25, across Canada and around the world, hate continued to rise and division increased. Trust in institutions and each other is waning. Many are asking, where do we go from here? And that's where the CRRF comes in. In 2024-25, we welcomed a huge milestone, receiving permanent funding from the federal government. During that fiscal year, we were able to deepen and multiply our work, guided by our three strategic priorities: catalyzing systemic policy change, building community capacity, and mobilizing knowledge and becoming a modern and effective organization. Next slide, please. And on the community front, we continue to help organizations across Canada combat racism. Our National Anti-Racism Fund delivered almost $3.2 million to 166 organizations in 24-25's fiscal year alone. Since its launch 4 years ago, the National Anti-Racism Fund has invested $12.4 $4 million to support powerful work of more than 750 organizations across Canada. And at the same time, we continued and expanded our media fellowships and municipal fellowship programs as part of our commitment to amplifying diverse voices and perspectives in institutions across the country. We supported over 32 fellows, providing the future generation with real, hands-on experience. These programs are an investment in our collective future. And in 24-25, we also brought community realities to decision-making spaces because policy only works when it reflects lived experiences. We contributed to key federal strategies addressing systemic racism, Canada's Action Plan on Combating Hate, Canada's Anti-Racism Strategy, and Canada's Black Justice Strategy. All were introduced in 24-25. Through our work at the Hate Crimes Task Force and the Combating Hate Hub, we work with partners across sectors to ensure that responses to racism are systemic. Some of that work includes the launch of our Building Bridges workshops, the first ever nationwide training series on hate crimes in May 2024. We trained 230 law enforcement members on how to identify, investigate, and report on hate crimes, and develop and distribute over 250 community toolkits. And that work continues today. The tool with the task force, we also partnered with Western Law School to develop the Hate Indicators, a Canadian hate crime case law research tool. It's the first of its kind in Canada and makes it possible for prosecutors and other legal professionals to easily search more than 15 years of hate crime case law in Canada, both reported and unreported decisions. In Quebec, we collaborated with 30 municipalities to develop practical resources for more inclusive cities. And our national town hall series, in partnership with the Globe and Mail, connected decision makers with community members across this country to advance policy solutions rooted in lived experiences, reaching nearly 2,000 people across this country. Permanent funding opened new possibilities for us to advance anti-racism work and build a solid, sustainable infrastructure of equity, justice, and opportunity in Canada. We scaled up key programming, and we now have more staff working towards our goals and collaborating with different partners. We continued our internal trainings on accessibility and inclusion and created plain language versions of reports and studies to make sure everyone can benefit from them. You'll find plain language summaries of our race relations in Canada 2024 study and inclusive municipalities guide on our website. Online, we're growing our audience and reaching new people from coast to coast with more new voices than ever, shaping the conversation on anti-racism in Canada. So let me close with this. In a moment where division is easy, connection takes effort. But it's that effort that defines who we are as a country. Addressing racism is not just about reacting to harm, it's about building something stronger in its place. Stronger policies, communities, and stronger relationships between people. To our partners, our communities, and especially the people moving this work forward, thank you. Let's keep going.
Thank you, Mohammed, for highlighting the Foundation's work and impact. We now move into our panel discussion, Health Equity and Systemic Racism, Rebuilding Trust in Canada's Healthcare Systems. The objective of this panel is to address the critical issue of racial equity in Canada's healthcare system. In light of new federal investments in healthcare, it is imperative that these resources are allocated with a racial equity lens to ensure that marginalized communities, particularly Indigenous, Black, and other racialized groups, are not only included in the conversation, but are prioritized in terms of access and care. I'm pleased to introduce our moderator, Dr. Bajyanta Mukhopadhyay, former director of the Office of Social Accountability and Community Engagement, Faculty of Medicine and Health Sciences at McGill University. Thank you, Dr. Baj, for moderating today's panel. Over to you.
Thanks very much, Oswa, and thank you very much for having me here. It's an honor to be moderating this panel with three fantastic panelists. And I'm really, really happy that the Canadian Race Relations Foundation has chosen to spotlight health equity, which I think is a very, very key issue where we see a lot of progress, where we can see a lot of progress when it comes to anti-racism work in Canada. I'm not going to say much. I'm just going to hand it over to our panelists. And so I'm going to introduce them as we go, and I'm going to ask them a specific question for their reflections on where anti-racism and health equity work can go forwards in Canada. And I'm perhaps going to start with, am I starting with I'm starting with Queenie. That's great. Hi, Queenie. Queenie Chu is the Chief Executive Officer of Success and the Success Foundation, one of Canada's largest nonprofit social service organizations. Her work focuses on advancing health equity, cultural responsive services, and addressing systemic barriers impacting racialized communities, immigrants, and newcomers. She's widely recognized for her leadership in health and social services and her long-standing commitment to equity, inclusion, and community well-being. Queenie, welcome. And as someone who works with various racialized and newcomer communities, including East Asian communities, mental health is often a neglected part of the broader health conversation. So I'd like to ask you, from your perspective, what are one or two things the federal government could do to make accessing mental health services easier and more culturally safe?
Thank you so much. Thank you, Teresa, and the Canada Race Relations Foundation for the opportunity to speak on this very important issue. And again, I'm Queenie Chu, CEO of Success, a nonprofit organization in BC serving newcomers, affordable housing, and culturally appropriate seniors care. I also would like to acknowledge that I'm speaking from the unceded territories of the Coast Salish peoples, including the Musqueam, Squamish, and Tsleil-Waututh nations, where we headquarter in Vancouver. As a community leader working closely with newcomers and refugees and diverse population, I see firsthand the growing gap between mental health needs and the ability to access timely and culturally appropriate care. Canada has made important commitments to mental health, and yet, for many, particularly newcomers, refugees, and racialized community, services remain difficult to access and too often not culturally safe. Today, I would like to highlight two major actions the federal government can take to meaningfully improve access and culturally safety in mental health care. First one, remove financial barriers and reverse the interim federal health program cuts. The federal government must ensure that cost is never a barrier to essential mental health services. Recent changes to the Interim Federal Health Program, IFHP, have introduced co-payment of $4 per prescription and 30% of cost for mental health counseling and other services. While this may appear modest, they have a profound impact on the very populations the program is meant to serve. Refugees and asylum seekers often arrive in Canada with significant trauma from war, displacement, and prolonged uncertainty. At the exact moment when access to counseling and therapy is most critical, we are introducing financial barriers that deter care. Medical and community organizations have warned these changes will discourage people from seeking mental health support, lead to worsening conditions, and ultimately drive higher costs through emergency care and hospitalization. This is not only inequitable, it is also economically inefficient. We have seen this before. Past cuts to interim federal health program were found to cause serious harm and were ultimately reversed. If we are serious about mental health, we must restore full coverage for counseling and psychological services under the interim federal health program, ensure the vulnerable populations can access care early before crisis escalates. Second, invest in culturally safe, community-based mental health services. The federal government must move beyond a one-size-fits-all model and invest in culturally safe, community-driven mental health care. Canada is one of the most diverse countries in the world, and yet many people still face language barriers, lack of culturally appropriate services, and experiences of discrimination within the health system. As a result, individuals may delay or avoid seeking care altogether, even they need it the most. Research shows that the newcomers are more likely to experience anxiety, depression, but are less likely to access services, often due to language barrier, culture, and system navigation. Cultural safety is not an add-on. It is fundamentally to effective care. The federal government can lead by investing in community-based programs, a community-based organization that already have trust and cultural understanding within newcomer and racialized communities, funding interpretation services, culturally adapted therapies, and peer support models, supporting co-design of services with communities, including those with lived experience, establishing and enforcing national standards for culturally safe mental health services. We already know that culturally grounded approaches improve engagement and outcomes. Whether in indigenous communities or newcomer populations, services that reflect language, culture, and lived experience are far more effective in supporting recovery and well-being. In closing, improving access to mental health care is not only about increasing services, it is about removing barriers, ensuring those services are safe, inclusive, and responsive to people they serve. So mental health care should be accessible to all, not just in principle, but in practice. Thank you.
Thank you so much, Queenie. A lot of what you said resonates with my own sort of day-to-day clinical practice, so I really appreciate your intervention. Thank you. We're now going to move to speaking with Cheryl Prescott. Hi, Cheryl. So I'm just going to introduce Cheryl. Cheryl is the Executive Director of Black Creek Community Center and has more than 25 years of leadership experience in health equity, anti-racism, and community-centered systems change. Her work focuses on addressing systemic barriers within healthcare and advancing culturally safe and inclusive models of care for Black and equity-deserving communities. She's widely recognized for her leadership in strengthening equitable and community-informed healthcare systems. Cheryl, welcome. And
Thank
I'd like,
you
yeah, no, go ahead.
Thank you so much for the introduction, and thank you for the invitation to participate in this very important conversation. Before starting, I'd like to acknowledge that I am joining from the North York area of Toronto, which is the traditional territories of the Wendat, Anishwabic, Haudenosaunee, Métis, and the Mississaugas of the Credit First Nation. As an immigrant living and working on this land, I am grateful for those who cared for and nurtured it for so many generations. I also acknowledge my ancestors of African heritage who were stolen people taken forcibly to new lands as a result of the transatlantic slaves trade. It is with this lens that I speak to you today in my leadership role at Black Creek Community Health Center, where we recognize the traumatic impacts of systemic racism on the health and well-being of Black, Indigenous, and people of color. At our CHC, our work begins with a simple belief that health is shaped not only by healthcare, but by the conditions in which people live, work, learn, and age. In the Black Creek community, we see every day how poverty, housing instability, food insecurity, precarious employment, racism, and social exclusion directly impact health outcomes for Black populations. While the community is rich in strength, culture, and leadership, for far too long, the experiences and needs of Black communities, in particular, have been overlooked or inadequately reflected in health research, policy, and planning. One of the greatest barriers we face is the significant gap in race-based and community-level data. Without meaningful data, inequities remain invisible, and systems are not held accountable for the outcomes they produce. What we do know is deeply concerning. that anti-Black racism and systemic discrimination continue to shape access and quality of care and overall health outcomes. Black communities do experience disproportionate rates of chronic illnesses while also facing barriers to timely and culturally safe care. One policy recommendation I do have is to make race-based data collection mandatory. Current federal data systems are inconsistent and incomplete. Canada needs mandatory, standardized race-based data collection across its systems. And that data must be governed by Black-led bodies to ensure its ethical use and community trust, so that it is not weaponized against the people it is meant to help and not harm them. I recall that during the pandemic, leaders in our community, in the community health sector, advocated for race-based data collection in Toronto because we saw that certain areas with high numbers of underserved groups were showing high rates of COVID infections. And the data helped us to ensure that these communities, identified as hotspots, got equitable allocation of, at the time, scarce vaccines. The speculations about vaccine hesitancy in the Black community was soon reversed when it became apparent that vaccine uptake increased when it became available to the populations that needed it the most, who had to go to work in precarious conditions, who couldn't self-isolate because they lived in crowded housing conditions. And this advocacy, along with using a community-led and community-grounded approach, I believe, saved countless lives. So this brings me to my next point on the need for targeted investments in community-led, culturally responsive care as my second policy recommendation, which is very similar to Queenie's one of Queenie's recommendations. We understand that healthcare alone cannot solve all the issues of inequity. Our approach in CHCs is community-rooted, it's culturally responsive, and it's grounded in trust. That means listening to lived experiences, investing in community leadership, and addressing anti-Black racism directly, as well as advocating for systems change alongside our service delivery models. While investments currently exist, mostly as a one-time limited projects and pilots, we need sustainable investments to expand funding for community health centers, Black-led organizations, and culturally responsive healthcare programs that are rooted in the lived experiences of Black communities, because these are the services that will help build trust, improve access to primary and preventive care, reduce stigma, and address health issues earlier, before they lead to those avoidable hospitalizations or worsening chronic illnesses. This recommendation is tied to the use of federal spending power that can drive sustained anti-racist primary care and prevention. For example, the Canada Health Transfer and bilateral agreements should include equity and anti-racism considerations, such as targets to reduce avoidable hospitalizations for Black communities, requirements for culturally safe, community-based primary care in high-needs Black communities, and reporting on race-based access and health outcomes. With some of these commitments, we can truly transform a system where Black communities are not simply surviving inequitable systems, but they're thriving in environments that support dignity, wellness, and opportunity. Health equity should not be just an aspiration. It's a responsibility for the over 1.5 million Black Canadians that enrich our country. And achieving it requires some courage, lots of partnerships, and accountability and sustained action. With that, I will conclude with my thanks. Merci, miigwech.
Thanks so much, Cheryl. And thanks so much for those very concrete policy recommendations that echo some of what Queenie said as well. And I think that's very helpful for this conversation. And we finally turn to our last panelist, Dr. Courtney Leary, who's the first physician raised in and now serving Norway House Cree Nation, where she is Chief of Staff for the Norway House Hospital and Clinic. Her work focuses on advancing Indigenous-led, community-centered healthcare and improving equitable access to care in northern and remote communities. She is recognized for her leadership in strengthening culturally grounded healthcare services for Indigenous communities. Courtney, welcome. And the question I'd like to ask you is, given the legacy of harm and resulting mistrust in institutions, including healthcare systems, what, in your opinion, are one or two priority actions in federal health policy that could help make systems safer for Indigenous communities?
Thanks for the question, and thanks for inviting me. My land acknowledgement will be a little bit different. So I think one of the things that we forgot to put in the bio is that I'm actually from Norway House. Kinesiology is my home community. I grew up there and went off for medical training and then came back and have worked there for the last 12 years now. So I am First Nations. And so when you ask about federal health policies, I mean, everything that we do on reserve is governed by the federal government. So we're a little bit set aside from provincial governments, and the physician funding still comes from the province, but we have to work within these federal systems. And then the other thing I'd like to start off by saying is, yes, I am Indigenous, and yes, I am First Nations, but that doesn't mean that I speak for all of them. There's no pan-Indigenous. My community is at the very top of Lake Winnipeg, the very large lake, and right smack dab in the middle of the country. So my lens and my perspective is very much of a Northern Cree perspective, because that's the community that I was raised in. So in preparing for this, when we talk about increasing trust in the healthcare system, my first thought is increasing Indigenous representation. And I did go to my think tank. I went to a variety of people that I work with, brought them the question, asked them what their asks would be. And everybody had a bit of a different perspective. Of course, most of it boils down to funding, but I can't represent them and their ideas. What I can only talk from what I've experienced and what I see. And what I need to see is more Indigenous representation within our health systems. And I am talking about real representation. First Nations health advocates for every First Nations community that are employed by Indigenous Services Canada. So somebody that is from the community or very close to the community that is able to walk in two worlds to be able to represent not just the people, but also the policies and find out a way to meld those two. We have, like NIHB, FNIB has medical consultants that work for every province, right? So the regional office has medical consultants that work for them that address concerns throughout the province for on-reserve populations. Those, for as far as I know, in Manitoba, that person has never been Indigenous. And that would be amazing. It would be even better if they were First Nations. So we need First Nations or Inuit medical consultants to the provincial or territorial FNIB offices. And forgive my ignorance about how things work. They do work a little bit different up north, more north than me, past the tree line. But we need that person for every province or territory who will collaborate with local stakeholders to address the healthcare concerns for each community. And these medical consultants need to have lived experience and work experience in the communities they represent. So this is what I mean about real representation, because we can ask random Indigenous person to be our medical consultant or to speak on a panel, but unless they've been there, lived it, worked with the people, have a connection to the community and a responsibility so that you know that your words are representing your cousins and the people that you live with and that you have to run into the store. So there's that increased sense of responsibility. So I think that's what I mean by increased representation. The second thing, I might have a few things, would be collaboration with provincial governments to provide primary healthcare services on reserve. So right now, most reserves have nursing station models, and that is all federally run. So we need to stop perpetuating the policies that being a First Nations individual on reserve disqualifies you from being a member of that province or that territory, and that you are somehow not responsible for, like from Manitoba Health, in my circumstance, and that I only am considered under NIHB. So the more separate we are, the more problems that we have, because the province here does have clinics that they run and they have doctors that they fund. So why is it that primary care is only a federal responsibility? I would like to see clinics being run on reserve that are provincial responsibilities as well, because we have to access all of the same hospitals. Also shifting the funds from medical transportation into community services, or at least start a working group that can start those discussions, because the medical transportation's pot of money is unlimited, but the community services pot of money is very limited. And when I go to my community, I want to be able to provide those services right there for those people, not having to ship everybody out, and add to the medevac costs and things like that. So I think equal funding for on-reserve healthcare that mirrors the provincial funding, but also meets the provincial standards, so that we're meeting the standards of triaging when somebody comes into a department. I'm almost convinced that the way that we run nursing stations might be medically illegal because people will call and ask if they can come in and be seen, and they'll be given a time. I mean, you don't call during an emergency, you show up, and you should get triaged within 15 minutes. And we need to meet those ACS protocols and our EMS protocols. So having some sort of standardized format across the board for all Canadians would be great, regardless of where you're living, right? And regardless of who's paying the bill. We all deserve that same care.
Courtney.
Sorry.
Yeah, we're
Am I taking
out
too
of
long?
time. I really don't want to interrupt you though. So as someone who's worked across the North for the last 12 years, so much of what you say just resonates so much. But thank you so much for sharing this. I don't think we even have time for our last question. I think I'm going to hand it over to Uswa to maybe guide us into the discussion part and maybe some of the common themes that I think I heard all three of you say about what unites these struggles. Maybe that will come up in the discussion. So thank you so much for sharing your perspectives, and I'll hand it back to Uswa for the discussion part, the questions.
Thank you so much to Dr. Courtney, Cheryl, Queenie, and Dr. Barge for this insightful discussion. We will now move into the Q&A portion of our session. So I've got a number of questions coming in, and folks, feel free to submit your questions. We have limited time, but we will try our best, and we will try and balance questions to our wonderful panelists as well as to Mohammed about the CRRF and CRRF's work. And so please feel free to submit your questions using the Zoom Q&A function. Like I said, we'll try and prioritize the ones on our annual report to make sure that there's enough time for our panelists as well. So I have a number of questions. I'll start off with a question to the panel, actually. And Dr. Budge, maybe you'll let me know who to direct this to. Immigrants and newcomers are often left out of health equity discussions. How do you fruitfully engage these communities?
I don't know, perhaps Queenie, you want to take that one?
Sure. Thank you very much for the question. And again, as I presented, it is important that, we invest, or federal government invest in the community-based organizations that already, have the trust and cultural understanding within the newcomer and racialized communities to look at those barriers, and how can we collectively looking at strategies that, from the ground zero up, to be able to engage people who have the lived experience in order to address those very important issues. And I think that really is the threads that come through Cheryl and Connie about, whether you are an Indigenous community, newcomers, and also local resident. These are very important issues about health equity, especially for the newcomers when they overlay with additional cultural and language barriers.
Thank you, Queenie, for that answer. Our next question is for Mohammed. So Mohammed, where is anti-racism on the government priority spectrum? It wasn't in the speech from the throne, but racism is still happening.
Yeah, that's a very big question. I think that when you look at the speech for the throne and the mandate letters, it is very clear that the federal government is hyper-focused on ensuring that the economy is one that everyone feels included on, that the projection of the federal and the economic environment is one that is highest of priority. I think that's extremely clear. In my discussions with many members of the federal government, and I would also invite my board chair if she wanted to weigh in as well. But polarization is a significant concern for them. They believe, and this has been said to me, that the greatest thing that is creating polarization in society right now is people's inability to know that they can put food on the table. So that economic focus is something that they are very much visibly honed in on. Now, the second thing that's also very true about this government is that they're extremely results oriented. So they want to see precise results and evidence for decision making. So if there's abilities for us to work with community organizations in particular who are collecting evidence, it'd be good for us to be able to use that to work with communities to push for those reforms, such as some of the ones that were mentioned earlier. Because I think that the opportunity is that this government is moving very much towards results and evidence-based decision making, which is great because I think that opens up the door for a lot. Now, the last thing I'll just say is that general society, when we poll, or when we look at polls around how does anti-racism poll in terms of the priorities of Canadians right now, it's not in the top 20 of issues. And there's a huge pushback against DEI. And there's a huge pushback against immigration. And you've seen cuts towards immigration as well. But I do think that this is like all moments where things go up and things go down. But the benefit of working here for me at least is that I get to see incredible community organizations who are doing real work, bringing these issues to light. And I firmly believe that, over time, these issues will take greater degrees of importance and relevance within the general society of Canadians. And I do think that if we can articulate and push for public policy that is evolving, that is better, that is taking into consideration, I think that's the way to go, because the reality is that the situation is getting worse for people. But we need to be able to push back against that.
Absolutely. Thank you, Mohammed. A question to our panel. Has there been a survey done on health equity in Canada? If not, what are the types of organizations that can facilitate that?
I don't know who'd be the best person to answer that. I don't know if any of you know of anything that's been done so far.
I'm not aware of any of the health equity surveys, but certainly I think that it's important to make sure the language that is being used is culturally appropriate and people feel safe to answer to those questions as well. That's kind of my suggestions.
Okay, Queenie, so you're speaking about in the development of any kind of survey needs to be culturally inclusive and the language needs to reflect community needs. Mohammed, I see you're raising your hand.
Yeah, I want to point towards the and Queenie, please correct me if you think there's more to be added to, but I believe that they passed an Anti-Racism Data Act, which mandated the government of British Columbia to collect a series of information based on users of public services that were provided by the province, by which they were collecting information about people's race, their use of public services, and how they would be able to serve the public in greater in a better manner by the use of that data. I know that information has been collected so far, and they use the health card as the spine for all the information collection. So therefore, health services, I believe, was also included in how and what they are measuring by race. They have an anti-racism data committee that governs the use of that data in particular. and an Indigenous governance committee also, because the right to be able to use that data. So that seems, from what I understand, is the largest collection of race-based data and use of health services. But I'm not sure yet, and Queenie, you would know better, I would assume, that around how that's now changing or moving public policy and the delivery of services.
I just want to quickly answer to that. And I think that this is very important element of it. I mean, BC just started beginning of that, but certainly I think that the collaboration and co-designing of the services with the communities is crucial. You know, I think it should be spreading across Canada, not just in certain province. And I think that working and co-designing with the communities that have been building those trust, with an understanding with the newcomers community, and as well as the racialized community, is vitally important.
Absolutely. And I might ask Dr. Courtney and Cheryl to weigh in also. If such data is to be collected, this research is supposed to be done, how can it be informed by the real day-to-day lived experiences of racialized communities across this country, and with the intersections also of racialized women, racialized migrants, racialized folks who may not have access to same kinds of spaces in rural areas, or with income disparities?
Well, I know that in Manitoba, in the tertiary hospitals, they had started doing like race data collection, and it was basically self-identifying. And I think I was worried when you were asked to self-identify when you would present, because to me, that seems like a very unsafe thing to do. Like, why would I want to target myself? But it was Dr. Marcia Anderson who put that study together. And it was nice to finally have numbers that showed that Indigenous people, that Black people were waiting much longer than anybody else in emergency departments. And without those numbers, the healthcare system doesn't have to acknowledge that racism exists, because doctors always need data to follow. So in terms of health equity in communities, I don't think that work has been done, but they've definitely started with just trying to see who can access healthcare services and emergency services right there in Winnipeg, and who's not getting it. So I think it's like waiting 8 times longer or something than another person. And so it's not just trauma and chronic stress and increased chronic illnesses, it's death. It's death for us. That's the outcome. So that's what we're trying to prevent. So yeah, we have to thank Dr. Marcia Anderson for piloting that within Manitoba.
And for Ontario, I do know that, as I mentioned, during the pandemic, when we saw the disproportionate impact on different community groups, we really advocated for race-based data collection. However, it happened sporadically. And, as community health centers, we do it all the time. We collect race-based data to inform our service delivery and, to really get to know our communities. However, I do not believe it's consistent across the different organizations, including hospitals. So my recommendation around consistent data collection and linking that to accountability is something that I really feel very strongly about. But I also know that unless survey and data collection is done in a way that's respectful of the populations that we're working with, the distrust that's there will not give us the information that we need, because many folks will not share their information for fear of it being weaponized against them. So I think there's lots of conversations that need to happen with community groups to help with that process. It's not simply a matter of sending surveys out and in thinking that folks will answer the questions honestly and accurately, or at all.
That's an important point, Cheryl. Thank you so much for adding that nuance. It's not just about the language. It's not just about where data is being collected, whether it's being collected with actual community representation in mind. It's also this importance of building trust from every step of the way. I know Dr. Courtney also brought that up. Thank you to our panelists for your important contributions here. My last question, Mohammed, I'm going to ask for you to rapid fire this very quickly with me, is I noticed that the CRF works mostly on justice-related work. This session highlights the need to focus on health equity. How will the CRF continue this important conversation?
Look, I think the CRF has evolving priorities, and part of what we've been trying to focus our attention on over the last number of years is, we knew that the government was going to create Canada's anti-racism strategy. We contributed towards that. We knew that they were going to create a combating hate action plan. We contributed towards that. We knew that there's a Black justice strategy that they were going to deploy. We contributed towards that. The online harms legislation that's coming up, C9 that's coming up. So part of what our focus has always been, and this may change in the coming days because we are doing a strategic plan. So if you do have input on this, please provide that to both us or to our board members as well. But we have been trying to stay ahead of the legislative curve to ensure that we are bringing into those conversations communities who have been disproportionately left out, but also ensuring that as the development of those key pieces of legislative environments are just reflective of the needs. So part of what we've been focusing on is just responding to that, but it's an evolving time, and I think that we are going to be, because our visibility of the federal ecosystem, I think we need to be able to figure out how to walk with different communities to ensure that their perspectives are more granularly integrated into the federal perspective. And that's how we hope to be evolving over the next little while, as long as our strategic. We have to wait till our strat plan is decided, which is what next year would look like. But part of what we are feeling is that there's a greater degree of integration that we need to be able to create to reflect those evolving priorities.
Thanks, Mohammed. That's very helpful and insightful in us knowing next steps, and for the wonderful people at this audience knowing how the CRF is working and working with community. Now, I am pleased to invite back CRF's board person, Teresa Wupa, for closing remarks, followed by Elder Bob's closing remarks.
Well, thank you. Thank you for a very engaging and informative panel discussion today. And I think we all of us have a role to play moving forward to perhaps help our public institutions have a better understanding on the interconnection between social and mental well-being in the contribution to our economy, in productivity and economic integration and growth. So thank you very much for the very insightful, informative panel presentation discussion. And as we come to an end of today's gathering, I want to acknowledge that the last couple of years have been challenging for our communities, reminding us once again of the importance of courage, collaboration, and steady dedication. The CRF has steadfastly walked alongside communities as they combat racism and hate. This is an invitation for all of you to join us in that journey. I also want to extend my heartfelt thanks to each and every one of you for being here today. Your presence and encouragement speak to our shared commitment to advancing equity, strengthening inclusion, and fostering a society where everyone feels a true sense of belonging. And looking forward, we remain strong in our resolve to continue to challenge discrimination, support communities, and uphold the rights and dignity of all individuals in Canada. Together, we will continue to build connections, amplify voices, and create the conditions for every person to thrive and contribute meaningfully to our shared future. We invite you to stay connected with us. Follow our social media channels, sign up for our newsletter, and explore our website for more information, including our latest reports and financial statements. Thank you again for your time, for your trust, and your continued commitment. It is now my pleasure to turn it back to Elder Bob Watts for the final word.
Thank you very much, Teresa. I've had the great honor of being part of a few annual meetings for the CRRF. And I have to say, I think they just keep getting better and better. So in my closing, I just want to acknowledge the efforts of the staff at the foundation, the board, and the many civil society and other organizations out there that partner with the foundation to try to create better communities and a healthier Canada. I want to acknowledge all of you for your support for the foundation, that it takes all of us standing shoulder to shoulder to combat some of these terribly divisive issues in this country and to build a stronger Canada where every child has a chance, every community has an opportunity to prosper in all the many ways that we think about prosperity, but in particular in terms of health and mental health. So I just will just say we'll lower the council fires that we've gathered around here to attend this meeting, and when we get back together again, we'll lift up these council fires that can help in so many ways in terms of the deliberations that we need to do. And just to wish all of you a good rest of the day and good health and much love for your families and for your community. So with that, just say, thank you, y'all go on. Have a good rest of the day. Anyway.